Transforming care through genomic medicine, personalized therapeutics, health services and outcomes research, and innovations in healthcare delivery. We're Children's Mercy Kansas City, presenting our audio interview series, Transformational Pediatrics, with host Dr. Michael Smith.
Welcome to Transformational Pediatrics. I'm Dr. Michael Smith, and today our topic is Image Gently, Why It Matters. My guest is Dr. Nima Kasraie. He's a medical physicist at Children's Mercy Kansas City and an assistant professor of radiology and physics at the University of Missouri Kansas City. Dr. Kasraie, welcome to the show.
Good morning.
So what kinds of changes in imaging have we seen over the years? Are we doing a lot more of these procedures? Is there issues of radiation overexposure? What are the changes you've seen over the years?
Oh, yeah, certainly. I think since the 1980s, if you look back, background radiation constituted something around maybe 83% of the total radiation that we received. The rest was medical. Nowadays, I think the last paper or census that came out was 2006, and that percentage is up to 50%. So that means almost 50% of the total radiation that we receive is medical based. So yes, there has been a drastic increase in the amount of radiation that we're getting from CT scans and fluoro machines, and so that's a cause for concern. Right. That's one of the reasons why Image Gently stepped forward with their campaign. Yep.
Yeah, and so exactly, and so what are some of the issues you worry about when we see this amount of exposure to ionized radiation? I mean, what are some of the things that worry you about the increased use of radiology? You know, we know it's done a lot for medicine, but there's a drawback to it. So what do you worry about with it?
Well, certainly. I mean, nobody can deny that imaging. I mean, has its uses. I mean, it's been established how useful imaging is. The thing is that the critical principle is to determine which radiological exams are necessary, when are they necessary, how do we ensure that they're done with the lowest radiation dose. Now, at the place where I work at Children's Mercy, we're specifically pediatric. We do only pediatric patients, and those are of particular importance because of there's a sensitivity that children have to radiation which adults don't have. And so that heightens the concern to safeguard our patients from unnecessary radiation that they may receive. So.
And why is it so important to think of a child so differently from an imaging perspective?
From an imaging, first of all, we know that children are 2 to 10 times more sensitive to radiation than adults, and that has to do with their cell cycle. And there's also the idea that they're younger, so they have a lot more time for any possible detrimental outcomes like cancer to manifest themselves. So that requires some special considerations when we image them. Some tweaking of the CT scans, some particular adjustments have to be made in order to optimize the protocols, so to speak.
Yeah. So tell us what you mean then by image gently. How do you define that, and how is Children's Mercy taking this concept into everyday, radiology practice?
Well, Image Gently, I think it was a campaign that was started around 2006, and I think it was initiated by a group of concerned pediatric radiologists. And what they set out to accomplish was to promote education and promote awareness of potential risks, and to provide education, awareness, and also shared decision-making with all the parties that are involved, like the patients, families, radiologists, technologists, the physicists, everybody, all the healthcare professionals. So to accomplish that, they have three what they call key principles. So there's justification, And their second key principle is optimization, and the third one is dose limit. So these are there are three focal points. A justification is, like I mentioned, it focuses on appropriateness. We need to ask ourselves whether the benefits outweigh the risks of performing the imaging tests on the individual patient. That question has to be first answered. Then there's optimization, which is, kind of my area where I come in and, ensure that radiation protection is optimized. In other words, I focus on ensuring that imaging tests using ionizing radiation are done under optimal conditions. Now, what do I mean by that? These optimal conditions maximize the information gained from the image while they limit the radiation exposure. So it's kind of a tricky, the task, finding that sweet spot. You want to lower the dose as much as possible, but you also want to keep the image, the information inside that image intact so that you don't lead to any false diagnoses.
Correct. Yeah, and so what about with kids specifically too? The fact that a lot of times in a pediatric population, they're harder to image. They're moving around a lot. There's a lot of repeat, shots that have to happen, even just with like a chest X-ray. Are there things that we're also doing, for the kid to making the exam room more comfortable? Different positions. Are we looking into that type of stuff too?
Yes, they do. Well, see, this thing that you're mentioning particularly surfaces in MRI because those exams are really long. They're like 20, 30 minutes. And in that case, if the patient moves, it's going to cause motion artifacts. But for X-rays, like, millisecond-long exposures, we don't particularly have that problem. And if we do, like, for example, some type of exam where it requires the patient to be immobilized, either they put him to sleep through, for example, they breastfeed the patient and then they fall asleep and then they put him under the scan. Or, we optimize some technique that speeds up the acquisition so that we minimize these types of problems.
So the image gently guidelines that you're discussing, obviously, larger medical centers are able to apply these types of guidelines. And what about the small practice, the community hospital? Do you see these types of guidelines being practiced there too, or is that an opportunity for Children's Mercy to reach out?
Yeah, that's right. It's actually an opportunity. I think Image Gently actually was, I think, in my opinion, designed for the latter group, like you're saying, because, see, in the pediatric world, all the machines, all the scanners, all the techniques that we use are already designed with the pediatric patient in mind. Now, a lot of these places that you're talking about, hospitals, these places, I think still it's even the case, they use the same protocols that they use for adults for their their pediatric patients, and so Image Gently, I think, was actually designed to bring the awareness to these practitioners that if you want to image a small patient, you should make some adjustments to the techniques that you're using, and they're not really too difficult to implement. Actually, it's just the awareness. That's the hard part, and I think that's what they set out to do.
Sure. Now you're a medical physicist. Are you seeing is there more opportunities for people in your profession to work with community hospitals? Or are those types of smaller hospitals hiring physicists to help them with their imaging?
They do. Yes, they do. Usually, large or well-established medical centers, they hire a full-time physicist. Sometimes there's a team of physicists that work and try to address these issues. But a lot of these smaller hospitals or these clinics that you're talking about, they kind of outsource this need. So there are physicists that come in on a need for need by need basis. They're called consultants, and they're actually required to come in once a year to check on the QCs, to look at the protocols, to do the compliance work. There's state compliance, there's NRC, Nuclear Regulatory Commission. There's a bunch of federal organizations that are watching over. There's the Joint Commission, and these they require that a physicist be involved in watching over the activities of the imaging that's going on in the department.
Well, Dr. Kasraie, I want to thank you for the work that you're doing with the Image Gently guidelines. It's obviously very important to, as you say, find that sweet spot, right? So we get the best out of our image technology with doing the less harm to the patient. So thank you for what you're doing, and thanks for coming on the show. You're listening to Transformational Pediatrics with Children's Mercy Kansas City. For more information, you can go to childrensmercy.org. That's childrensmercy.org. I'm Dr. Michael Smith. Thanks for listening.